Okay, good morning and welcome back to Ask the Doctor. I'm your host, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, and any nutritionally related topic. Remember, I'm a board certified optometric physician. I'm also a certified nutritional specialist. I hail from the Lange Eye Institute in the Villages, Florida. And if you got a question, pick up the phones and give me a call. Anywhere in the South or the continental U.S., a lot of people listen live via the internet all over the world. So phone number is 1-866-977-4820, 1-866-977-4820. Remember, the consultation is free. This never replaces a comprehensive eye exam or medical evaluation. That makes my attorneys happy if they're listening. One more time, give me a call, 866-977-4820. A few of the radio stations we're broadcasting through are 820 Genesis Communications, 820 a.m. out of Tampa Bay. That picks up, almost the whole state of Florida. 97.3 FM, The Sky, all the way up in Gainesville, up to South Georgia, down to Orlando. And then News Radio 1440, Montgomery, Alabama. So that's a few stations you're picking us up on right now. Once again, final phone number, 866-977-4820. Also, I want to make an announcement. Dr. John Podlatsky, he is doing a seminar on December 14th at 7 p.m. at Laurel Manor Rec Center. So for those of you that live in the villages, I think you have to be a village, you might have to have an ID card, but it's 12/14, December 14th, 7 p.m., Laurel Manor Rec Center. It's all going to be on Alzheimer's disease, early detection, and what we can do. Now, I got to tell you, I'm working very closely with Dr. Podlatsky. I'm downstairs in the Lange Eye Institute. We are involved in some early studies also, how we can detect Alzheimer's in the early stages through an eye exam. We got some really cool technology at the Lange Eye Institute that actually detects beta amyloid plaque in the eye and things like this. So there's three things that eye doctors have to look for that helps us make a diagnosis, an early diagnosis of Alzheimer's, and then we can make the appropriate referral or adjust your diet and your supplements. Number one, cortical cataracts. Number two, neurofibrillary atrophy. And number three, drusen in your macula. We look for all of that on routine eye exams. We have a test called the Anitas RHA that scans through all layers of the retina, looking for these drusenoid bodies in the earliest stages, even before we can detect it with our direct ophthalmoscope, indirect ophthalmoscope, before a retina specialist or anybody can see it. So the Anitas RHA is a piece of technology you may want to have done. It's not covered by Medicare insurance. I think it's about $40, so it's not that expensive. So if you're interested, you can come to the Lange Eye Institute and have that done. Or you can talk to your eye doctor. There's not many of them in the state of Florida, only 4. Many states don't even have 1. So this is brand new technology, and we try to stay ahead of the game at the Lange Eye Institute with this. So once again, remember, Dr. John Podlatsky, 12/14, 7 p.m., Laurel Manor Rec Center in the Villages. All right, we were talking a little bit about multivitamins. You don't want any beta carotene. You don't want any vitamin A. You don't want any copper. I don't like zinc oxide either. Zinc monomethylthionein is much better. So I created a multivitamin called Fortifeye Complete Once Daily. And it's a combination of everything your eyes need and everything your body needs, all the good without the bad. You can learn more about it at fortifeye.com. And that's a 1-a-day vitamin that you take. Then if you're a little bit larger, a little bit more active, athletic, or aging a little bit more rapidly, you may want to take 2 a day. So you don't take Fortifeye Complete Once Daily, you go to Fortifeye Complete. That's 2 a day, and you get a discount on that, so it's a lot cheaper than buying 2 of the 1-a-day bottles. Now remember, we do have a special, and we're running that special right now. It's a Christmas special. Write this down. If you go to the website, at checkout, you enter the code WINTER1, and that means you're going to buy 3 bottles of the multivitamin and you get 1 for free. So you got to go in and put 4 in, but they're going to take the price off on 1, so you're only going to pay for 3. If you're going to get the 60 count, that's called Fortifeye Complete, not the 1 a day. You're going to get the 60 count, you use Winter 2, all right, at checkout. And you're going to buy 3, get 1 free. So that'll tide you over. A 4-month supply will give you plenty to get absorbed into your blood and your cells, and you will see a difference and feel a difference. More pep in your step. A lot of people are noticing that they have better visual acuity, increased night vision, things like this. Also, blood chemistries are starting to improve. All right, let's go to the phones. We're getting loaded up. Let's see, I think Vince in Tampa, good morning. Fantastic. What can I do for you? I would eat the avocado, all right? Avocado has a fat in it, but it has very good fat in it, okay? And if you're getting olive oil, make sure it's organic, extra virgin olive oil. My favorite on the market now is Bragg's, okay? But I like coconut oil better, okay? Because here, Vince, you got to remember, when you heat olive oil up, it starts to smoke. So you got to cook with olive oil at very low heat. It takes a long time to cook products. Otherwise, it turns into a carcinogen. Coconut oil does not do that. Thing I like about coconut oil, it has fats in it too, but it has medium chain triglycerides and lauric acid. Very good for your health, especially for your brain, helping to reduce the possibility of neurodegenerative disorders. And that's a good segue. I was just talking about Alzheimer's and how we can detect it early through an eye exam. So cook in coconut oil. Even take a teaspoon of coconut oil a day, maybe put it in your smoothie, blend it together. But avocados, eat the whole avocado. Very good for you. Yeah, right. Yeah. Well, boron is important for health, but once again, it's like anything. Even copper is important to health. You got to have copper, but too much is the other side of the story. So you're going to be fine. If you eat 1 or 2 avocados a day, you're not going to have a problem. But everything in moderation, don't eat, 5 or 6 of those a day. I like to alter things. I don't want you to eat the same thing every day because then you can develop sensitivities and allergies to it. So maybe have an avocado 3 times a week. Mix it up. Don't ever do the same thing every day. Like, don't eat the same breakfast every day, the same lunch. Don't always do the same thing. Mix it up. Keep your body always guessing. All right, Vince, take care. All right, you're listening to Ask the Doctor. I'm Dr. Michael Lange, Lange Eye Institute and Fortifeye Vitamins. I'm going to give you the number for Fortifeye Vitamins. If you ever have a question, they just about know everything I talk about on this radio show. You can order any of the supplements I've developed. You can find out where I am if you call the gals at Fortifeye Vitamins. The phone number for Fortifeye Monday through Friday is 866-503-9746. That's 866-503-9746. Or you can learn a lot more at the website, fortifeye.com. It's kind of a play on words. Fortif and then I, like your eyeball. So Fortifeye, fortifeye.com. Remember, the Fortifeye Complete once daily, and the Complete has that special buy 3, get 1 free if you use Winter 1 as the code, or Winter 2 for the Fortifeye Complete 60 count. All right, and you can always call Fortifeye Vitamins if you're confused. We'll honor that over the phone. If you live in Central Florida, you can go to Fortifeye Vitamin headquarters right there on 17th Street. I think that's 1510 Southwest 17th Street, right next to Wood U. You can't miss the Fortifeye sign out there. You can go in there. They'll give you a free protein shake. You can try it before you buy it. All right, let's go back to the phones. Nick in Gainesville, good morning. Mm-hmm. Right? Absolutely. Is there a trick? Is there a trick to the trade? So a lot of people have the same problem as you. When they put a soft contact lens in their eye, it doesn't adhere to the eye and then it pops right out. So what you want to do is put a lubricating eye drop in your eye before you put the contact lens in, okay? If your cornea is very dry, you try to put the contact lens in, it just pops right off of your eye. So put just an artificial tear in your eye maybe a minute before you put the contact lens in. Make sure your finger is very dry, okay? Your contact has to be wet, your cornea has to be wet, but your finger has to be dry. So make sure your finger's dry. Then capillary attraction is going to attract it right off of your finger, and it's going to suck right to your cornea, and you ain't going to have that problem anymore. Yep, lubricating drop beforehand. And then the other thing is, Nick, if you ever have that contact lens in backwards, all right, if it's inside out, it's going to say the same thing. And a lot of times it's very difficult, a soft contact, to tell if it's inside out or not. It's not going to hurt you if you put it in backwards. It's going to be uncomfortable. It's not going to adhere to your cornea, and it can pop out easier. So make sure it's not inside out. Make sure your cornea is lubricated, your finger's dry, and I bet you my bottom dollar you don't have any more problems. Right, so it's usually incorrect when you pull it out of the carton, the contact lens solution. It's the correct way. Don't flip it over, and then it goes right into the eye. Usually that's the way it is, but it has to look like a bowl on your finger, and you can do something called the taco test. If you turn it in, the edges want to touch just like a taco. If they go out, that means it's inside out. If they won't turn in and touch the edges, like if you're doing the taco, a burrito test, then it's inside out. Mm-hmm. Right? Well, yeah, L-arginine is very good. I mean, L-arginine has some definite benefits, and that's why I like people eating watermelon, believe it or not. L-arginine is a type of amino acid, all right, which is building blocks for protein. But yes, our protein has arginine in it, our Fortifeye super protein, all right? But also, and that's why if you work out, all right, if you're out walking or exercising, hitting the gym, if you take our Fortifeye super protein, which is a non-denatured whey protein concentrate from grass-fed New Zealand A2 cows, if you take that, take a scoop of that, or some chocolate milk. It doesn't have to be organic. The chocolate milk has to come from A2 cows. So if you go to Fresh Market, you can buy Fresh Market chocolate milk, their brand. That's coming from Jersey cows, which is an A2 cow. So you take chocolate milk, you take the protein, and you take a wedge of watermelon, and you blend it all together, and you drink it down. That combination is giving you whey protein, casein protein from the right source, a good casein protein. It's giving you high glycemic index from the chocolate and the watermelon, and then L-citrulline, which converts to L-arginine, so vasodilates the blood vessels, bringing the protein right to your muscle after working out. It is incredible for anti-aging. So that's a natural way of getting L-arginine. You're getting it through the watermelon and through the protein I developed without taking a pill. It's called Fortifeye Super Protein. Right, you can get it right on the website. All right, take care of yourself. Yeah, and there's a lot of benefits to L-arginine. You can look at it on the internet. Everything from coronary heart disease, high blood pressure, cholesterol, lowering inflammation. I mean, there's a whole host of benefits. But I like getting as much as you can from the food source, from the whole food source. All right, phone lines are open, 1-866-977-4820, 1-866-977-4820. Remember, I told you to go to online, Google the perfect meal for macular degeneration. I come up #1 in the world. Also, for all of you that are working out, bodybuilders, weightlifters, weekend warriors, you're just trying to stay in shape or get in shape, you can also Google the ultimate post-recovery workout drink. I come up #1 in the world in that. The ultimate post-recovery workout drink, and it goes into detail why this combination of nutrients I was just talking to you about, watermelon, the right chocolate milk, and Fortifeye Super Protein, why it works. Or you can get to it inadvertently if you go to our website. I've created a website just